Today we are going to discuss about rhinitis, one of the important upper respiratory tract disorder. Rhinitis is, as the name itis indicates, it's an inflammation of the mucous membrane of the nasal cavity, like here. And rhinitis could be three types. The most common one is allergic rhinitis. The second most common is viral rhinitis. Viral rhinitis is also known as common cold. Another type of rhinitis could be non-allergic. The allergic rhinitis is basically due to the presence of an allergen. The allergen could be anything like a dust, it could be mold, or it could be pollen. The primary symptoms of rhinitis is sneezing, itchiness in the nose, eyes, and the throat, watery eyes, and also runny nose, also known as rhinorrhea. And for the treatment, there are several treatment options available, such as first one could be, say, non-pharmacological, without any drugs. Non-pharmacological could be like using a nasal spray, like nasal saline solution or nasal irrigation, which is safe for pregnant women and children. The other options could be using HEPA filters or vacuum cleaning or paying attention to the pollen forecast as applicable. The second type of treatment we have, they are intranasal corticosteroids. The intranasal corticosteroids are actually the first line treatment option for chronic moderate to severe rhinitis, and these drugs are available over the counter, so these are OTC product, and the examples are triamcinolone or Nasacort, fluticasone or Flonase, and budesonide or Rhinocort. Fluticasone is also available in the market as an inhaler. The product name is Flovent, but for intranasal route, the product name is Flonase. And there are several side effects associated with intranasal corticosteroids. As you know, it can cause dry nose, and due to this dryness of the nose, it can cause nose bleeding or epistaxis. And also long-term use of intranasal corticosteroids can lead to localized infection in the nose or nasal cavity. The third type of treatment options are known as oral antihistamine. So these oral antihistamines are basically targeting the H1 receptor or histamine 1 receptor. So they are the antagonist of histamine 1 receptor, and these are the drug of choice for mild to moderate type of disease. And there are basically two generations of antihistamines. In the first generations, we have Benadryl or diphenhydramine, and in the second generations, we have drugs like loratadine. The primary difference between the first and second generation drugs are the first generation drugs are more sedative compared to second generation drugs. And also the first generation drugs, they are not to be used for nursing mothers and children. So these oral antihistamines are indicated for the itchiness or sneezing for rhinitis and also for allergic reactions, but they have little or no effect on the nasal congestion. Their side effects, as I mentioned earlier, they are more sedative, so their side effects includes dizziness, and also these antihistamines have some anticholinergic side effects. So that's why you can expect dry mouth, urinary retention, blurred vision, and also constipation. The first generation drugs have been also associated with photosensitization. So that's why there are some contraindications for oral antihistamines. So these drugs should not be given to newborns or premature infants, especially the first generation drugs, and also nursing mothers, and if someone have narrow angle glaucoma. So all are due to the anticholinergic side effects. So these are contraindicated. In case of narrow angle glaucoma, and also in case of acute asthma and stenosis peptic ulcer, and also in elderly patients. And there is one common warning associated with oral antihistamine is that they should not be combined with MAO inhibitors. As you know, MAO inhibitors are common antidepressants, and so these monoamine oxidase inhibitors should not be combined with oral antihistamines. The another kind of treatments are nasal decongestants. So these are, you can say these are number 4. So these are nasal decongestants, or their mechanism of action is they are basically alpha adrenergic agonist or sympathomimetic drugs. So basically they reduce the airway resistance and they constrict the dilated arterioles in the nasal mucosa. The common examples of nasal decongestants are phenylephrine, and also, as you can remember, phenylnephrines and epinephrine, they are closely related, and these drugs are also available as nasal and oral products. One of the nasal decongestants is actually a scheduled substance which is known as pseudoephedrine. So pseudoephedrine is basically used for the preparation of addictive substances, and that's why it's scheduled. And the intranasal drug delivery will be faster than oral route, so that's why if you have intranasal decongestants, it will be faster acting. And also, usually the drugs which has D at the end of the product, like Mucinex D or Robitussin D, usually they have a decongestant. D stands for decongestant. So it means that that product contains usually one of the nasal decongestants. And usually these products produce rapid effects when used, and when used nasally they have rapid effects, but when used orally the effect is a little bit slower, but the duration of action becomes longer. The adverse effects associated with them is, as you know, since these are sympathomimetics, so they have some side effects like cardiovascular stimulation, tachycardia, and also CNS stimulation. And if these drugs are used for chronic fashion, like for long-term use, they can produce side effect like rhinitis medicamentosa. So this is basically due to the activation of beta adrenergic receptors, which leads to vasodilation. So ultimately, if you use it for long term, the rhinitis becomes worse. So these nasal decongestants, since they are sympathomimetic, these drugs are contraindicated with any other sympathomimetic drugs like MAO inhibitors, and also they are contraindicated in hypertensive persons, if someone has uncontrolled hypertension, ventricular tachycardia, and also diabetes, benign prostatic hyperplasia, or glaucoma. And so these drugs are also should be avoided in children.